Hello and welcome. My name is Steph Tom and I am the Programme Lead for the Safe Staffing Programme here at the Care Inspectorate. We have developed this bite-sized video for local and integrated authorities to support reporting for the Health and Care Staffing Scotland Act 2019. The Health and Care Staffing Scotland Act 2019 was enacted on the 1st of April 2024. There are four parts to the Act. Part 1 is where you will find the guiding principles which are for all stakeholders to follow. These set out the main purposes of the Act alongside what the NHS and social care services in Scotland should take into consideration to staff services effectively with well-trained and supported staff. Part 2 sets out the responsibilities and duties for NHS services and includes the details of their reporting duties. Part 3 sets out the responsibilities and duties for social care services, the Care Inspectorate, and details local and integrated authority reporting duties. Part 4 is where you will find the general provisions which give powers to the Scottish Ministers around enactment of legislation and to make amendments as necessary. All local and integrated authorities must publish their report locally, as well as sending it to the HCSA email inbox by the 30th of June. This first report is for the financial year 24-25. The Adult Social Care Workforce and Fair Work Division will support ministers with their reporting duties, and one of the ways in which they will do this is by collating all of the local and integrated authority reports once they have been sent to the HCSA mailbox. The Scottish Government has published statutory guidance which supports the Health and Care Staffing Scotland Act 2019. It provides information for all relevant stakeholders of their responsibilities under the Act. Chapter 15 is for local and integrated authorities to support their understanding of planning or securing the provision of care services from others, including their reporting duties within the HCSA. This year, there are two set questions which were sent via electronic letter, which included the reporting template on the 11th of February 2025. This letter was sent to all Chief Executives of local authorities and all Chief Officers of integration authorities. This was from Ian Turner, the Deputy Director for Social Care and National Care Service Development in Scotland. All services listed under 47.1 of the Public Services Reform Scotland Act 2010 should be included in the annual report. This can be easy to remember if you think of it as all services registered and inspected by the Care Inspectorate. All local and integrated authorities should self-assess and use their current policies, procedures and processes to complete the first report. Only services planned or secured in 24-25 should be reported on. The guidance is clear in 15.5 that the requirements of the Act only apply to the planning and securing stage of a care service. There is no requirement under the Act for ongoing monitoring or scrutiny of third-party providers. You can extend contracts with no need to report. However, once a contract is renegotiated or renewed, this would be reportable under the HCSA. Here is question 1. You will find this question with guidance for answering in the reporting template sent on the 11th of February 2025 by Ian Turner, the Deputy Director for Social Care and National Care Service Development in Scotland. All local and integrated authorities must detail the steps they have taken as an organisation to comply with Section 3.2 of the HCSA. Here is question 2. As stated previously, you will find this question with guidance for answering in the reporting template sent on the 11th of February 2025 by Ian Turner, the Deputy Director for Social Care and National Care Service Development in Scotland. This follows on from the previous question and is related to any risks your organisation has found that has affected your ability to comply with the duty set out in 3.2 of the HCSA. To support local and integrated authorities to report on the two questions set for 24-25, Let's look at what they must take account of when planning or securing a service from a third party. They must have regard for the guiding principles. However, this is also true of all social care services registered with the Care Inspectorate. All 8 of the guiding principles can be found weaved throughout the health and social care standards as well as our Care Inspectorate quality frameworks. This means regulated services in Scotland have worked with these principles for a few years now, although this is the first time they have been written into primary legislation. This means they are very familiar with these principles in general and can now adhere to them specifically for staffing in line with the HCSA. Local and integrated authorities must also ensure the service has appropriate staffing with or working towards the correct qualifications and training for their roles. They must have regard to the statutory guidance and ensure they work to all guidance issued by Scottish ministers, who have the right to change or add to the legislation at any time. We just want to highlight here again that local and integrated authorities must only report on services planned or secured by a third party in the financial year 24-25. The Act is not prescriptive on how local and integrated authorities inform their reports. There is also no expectation about the level of information to be provided in the responses to the 2 set questions. This flexible approach by Scottish Government enables and encourages local and integrated authorities to report any challenges around the Health and Care Staffing Scotland Act 2019 compliance and risk, whilst aligning it with their current reporting systems and processes. This means it is up to local and integrated authorities to decide what information should be included and how they wish to do so. Reports may highlight local and national priorities in social care, which Scottish ministers will use to inform their Scottish Parliament reporting duties. What can local and integrated authorities use to inform their reports? There are several places they can look for information. They can access inspection reports for the service they are thinking of commissioning. They can also look at joint inspection reports for services regulated by other stakeholders, such as Education Scotland or HIS. The Care Inspectorate data store can also provide data, and this can be found on our website and is accessible to everybody. Lastly, all local and integrated authorities will have their own commissioning experience alongside their own quality assurance processes, which can be used to inform their reports. There is no one-size-fits-all approach to this, and ultimately it is up to the local and integrated authority to self-assess and use what they deem to be relevant for their reports. There is no right or wrong way to complete the reporting template. 8. Scottish ministers must place a report before Scottish Parliament on staffing in health and care services. They will use the reports published by local and integrated authorities and the NHS as per the HCSA. They may also use information collated by the Adult Social Care Workforce and Fair Work Division to ensure they are covering all aspects of staffing in Scotland. They may include the effect staffing levels have on the discharge of the HCSA duties, steps Scottish ministers have taken to support staffing levels in services to assist the discharge of those duties, how information and data is considered in determining the future supply of registered nurses, staff, and any other kind of care professionals considered relevant, the steps that Scottish ministers have taken to ensure funding is available for services to assist with the discharge of those duties. The Scottish Government and other stakeholders have developed multiple guidance documents to support with local and integrated authority reporting. We have linked these on our Local and Integrated Authority tab on our Safe Staffing hub pages. We have recently compiled an FAQ document for local and integrated authorities, which you will also find on this tab. Please check out our hub pages for all of this information and guidance. Social Care Workforce and Fair Work Division and the Safe Staffing programme understand there is learning to be had after the first round of reporting has taken place. Due to this, we have devised a plan to consult and evaluate the first year's reporting. We will need support from local and integrated authorities in order to do this. so please get in touch with us at the Safe Staffing Programme if you would like to be involved. Once this has taken place, we will gather the feedback and review with the support of the Adult Social Care Workforce and Fair Work Division the questions and the guidance. We would then like to co-produce a worked example for the reporting year 25-26 with the support and input from local and integrated authorities. Thank you for watching our bite-sized video. Here at the Safe Staffing Programme, we are available to discuss your questions and queries over email, a Teams call, or a session for you and your colleagues to inform your reports. On the screen, you can use the QR code to register for our mailing list, as well as our email address if you would like to ask for further support. We want to reiterate, there is no right or wrong way to complete the HCSA reporting template. Thank you, and please get in touch if you have any questions.